Welcome to the What Now podcast, a podcast for people who are struggling through the 5 stages of grief. Nurse Melinda is here to show you how to embrace it and cultivate it into something beautiful. And now to assist you in the journey of life's shit show, Nurse Melinda.
Well, hello, Nurse Melinda.
Hello, Michael.
How are you doing in the travels of life's shit show today?
I don't know, every day. Every day there's got to be some shit we got to take care of.
You know, what I was thinking as the intro is going, and, you know, the topic for today's What Now podcast is Embrace Cancer. But I'm listening to the music, and the music is very lively, and I'm thinking, I want to dance, and it might be a little, maybe it's too happy to embrace cancer.
Maybe. But if you
Maybe
can find joy in anything,
Yeah.
then let's find joy in the music.
Maybe we just all need to listen to some cool music while embracing cancer and just have a good time.
That's right.
You know, I know there's a lot of theories about what cancer really is. I mean, what is this stuff? Is it a rogue cell? Is it an injury that doesn't heal? Or maybe the rogue cell is causing the injury not to heal? What is this stuff?
Exactly.
Oh, okay. We'll see you guys
That's all we
next time. We'll go back and listen to some music. Good luck, guys.
For real, right? I think that it's interesting. The more I study it, the more theories come out. Is it a rogue cell? Is it just some random cell that didn't repair correctly? And so it is replicating, and each time it replicates injured over and over and over again. Or is it an actual injury somewhere, like a scar tissue or a cut, or, you know, inside where you've had maybe, I don't know, some damage, and it's went to repair and couldn't repair itself, and so it just is now just consistently trying to repair itself, and so it's just building and building and building this tumor of cells that aren't doing the repair job, which was a new theory that I just read about, and I was like, you know, because of how much money have we put into the study of cancer and the cure of cancer, and we still have no idea what it is.
Really?
Like, we don't. We know how to cure it to some extent, but nothing is ever guaranteed. Nothing is guaranteed. And so, you can go, you have cancer diagnosis, and you go to the doctor and you say, well, these are your options. And you take chemo and you take radiation. The theory is it kills every cell, and then you have healthy regenerative cells that come back. But does it cure it? No, it puts it in remission.
Yeah, remission.
And remission is, it's just sitting there waiting for it to come back later, or does it come back later, or do we, you know what I'm saying? We really just don't quite know.
So, you know, that's really an interesting theory. So I'm thinking, I'm going to take your situation. Let's say that we have an injured cell that is not replicating itself properly, and it keeps screwing itself up, and it's developing into this thing. Wouldn't the red or the white blood cells go, hey, this is not right, we should go over there and kill it?
But maybe it does. But then sometimes, you know, I mean, if you think about this world inside our body, it encapsulates itself, so it can't be taken out.
Oh, never mind.
And then it just grows, right?
Yeah.
So I mean, our body has this innate ability to take care of itself and fix itself. But when something goes wickedly weird, then it tries to stay in homeostasis. And, you know, why? I don't know.
So in trying to do that, it might actually be causing harm because that's very interesting.
Yeah.
So, wow, that is really interesting. I was always, well, you're the nurse, so I'm just going to talk as if I'm a normal person. Well, normal as I can possibly be. Sorry, normal people. You're stuck with me.
We're going to pretend we're normal today.
Yeah, I pretend I'm normal today so I can represent some of the normies in the audience. So I was thinking, I've been taught that cancer is basically the cause of like inflammation. And if you eat horrible food, like a lot of sugary stuff, that causes your body to become inflamed, which could then cause some of these cells in your body to mutate or something to combat the inflammation. Then you got all this stuff going on. So you think you're getting better, but you keep eating deep fried Twinkies, which are not helping the situation. I mean, could that be part of it?
Yeah, I mean, that's definitely one of the studies and theories, that we've had for a very long time is that what happens? But then if you're thinking about it, same thing, like the inflammation, is it causing damage, which is an injury?
Yeah.
And then it's trying to repair itself and it can't because you're not giving your body what it needs to have a healthy life, right? And we know that sugar is the most biggest cause. Well, I say we know, then I say we don't know, right? So what is it? We theorize that sugar is the biggest cause of inflammation in our diets with our processed foods and foods that are not foods. Like my daughter gave me a hot dill pickled Cheeto yesterday. That's not a food.
No.
Why are we calling that food? It's not food. It's a lab processed item we're putting in our mouth. So when we do stuff like that, we are not giving ourselves or our bodies the ability to regenerate healthy cells.
Yeah.
We're giving it stuff that we're expecting it to break down and we're expecting it to function. We're expecting to go now out and run 6 miles on hot flaming
Cheetos. Or
dill pickled
whatever they
Cheetos,
were.
whatever they were. You know what I'm saying? And we can't expect our bodies to perform at its ultimate function if we're going to do that. And you know what? That's your choice. If you're going to do that, that's your choice. But there's consequences for choices.
Yeah. Is dark chocolate considered a food? Am I okay?
I don't know. I have a friend who makes chocolates, and she is like, I think she's at 80%. So it's like legit chocolate. It melts in your mouth.
Oh.
It's amazing. But if we go down and buy the name brand stuff, won't mention the name because
No,
it's Easter.
No, we don't do that.
Stinking Easter. We don't. I don't know what is that?
I don't know. I know that in the mall there's a little old lady named Mary who makes some good stuff, and we'll go down there. But that's probably the only stuff that we actually eat. I know when Linda's got a craving for chocolate, and then we go to the store. I mean, she's pulling out stuff. She reads every single ingredient that's in the bag. If it's like 50 words long, nope, you put it back. If there's things in there she doesn't know or can't pronounce, she puts it back. If there's just things like chocolate, cacao, sugar,
Yeah.
or that's fine.
Yeah.
She'll do that sparingly, but
I tell everybody on a weight loss program, now we're kind of getting off tangent, that it's one ingredient foods. So you turn it around and the label has one ingredient. That's the food your body wants.
so chocolate is more than one. We're chocolate, one ingredient. Pass that bucket over here.
Yeah.
Wow, that's pretty interesting. What are some foods that help to reduce inflammation, which might help us control our cancer?
Do you know broccoli is going to be your friend?
Oh, God, help me.
Got to have the green leafies. They hold vitamin D. And, then we talk about vitamin C. There are studies out where high vitamin C doses actually stop the cancer growth and sometimes can reverse it. So I'm doing more research on that because I really want to know what that is. Like, what is a high vitamin C dose and where, we can give it to you IV. That
Right.
the study I read, if you take it orally, it doesn't do anything because it has to go through the liver and, have to do the first bypass and all that stuff. But if we do it IV on high doses, then it really works well. But how long does it work? Does it reverse it? Don't know. I'm still studying that. But I'm very, very interested in that because even if you have cancer and you've decided you're going to go through chemo or you're going to go through radiation, let's give your body what it needs in order to healthily or be as healthy as it can be during that process. And if that is doing regenerative medicine or if that's doing vitamin C or if that's doing high vitamin D, then let's do that because we want to give you your biggest fighting chance.
Right.
Right. And I'm sure that the cancer doctors in town, because we have a lot of them, and we have one special one who is amazing at his job. I'm sure he does similar stuff in his IV segment of your treatment. But, it's always good for people to know, because that way we can support our patients too.
Yeah.
Because if you're a patient, you don't know what to ask. You don't know, you go in thinking, well, we're the experts. And so what we say should be right. But at the same time, you need to know what questions to ask. So that's part of my goal too, is just to make sure you have a resource of, I am going to do this. What questions do I ask?
So I have a question.
Yeah.
This is a question to ask.
Okay.
So what's your opinion on apple cider vinegar?
Apple cider vinegar, and there is a scientist in town. I don't even know if maybe we should have him on. We should have him on the show.
We should. Let's bring him up. No.
Yeah,
let's go get him.
that's a good idea. Anyway, he has the theory. We've known that cancer doesn't grow in. So you have acid and you have base,
Right.
and so the vinegar is an acid that switches your body. And so he does CO2 rooms and is studying CO2 rooms, because you have the hyperbarics and then you have the CO2, but there's got to be a balance to that. But the theories on his is it can't grow if our pH is lower.
Right.
And when we are born with a pH of 7.2. But as we get older and our bodies are having so much oxidative stress and so much life at us, free radicals and environmental toxins and plastic bottled water, all the stuff that we say causes cancer. If we have all that, then it raises our pH, which allows for disease processes to happen. And so in his studying and in his theory is, if we can get back down to that low pH, then we are going to be better and more healthy. And I would love to have him on this show.
Yeah, we need to do that. I think it'd be great. So I'll share with you one of my health secrets.
Okay.
In front of millions of people. So every day, what I try to do is I take 2 tablespoons of apple cider vinegar and some honey and mix it up and then put some water in there, or some sparkling water, because it tastes more like apple cider that way. And I slam that sucker, and it seems to work wonders. I'll take a double dose if I feel like I'm coming down with a cold or something like that. But I think it kind of balances my system out and keeps the pH and the acidic balance. I mean, all that imbalance, it seems to work really well. So, hot tip. I'm not a nurse, but that's why I was curious about what your take was on apple cider vinegar.
Yeah, and honey has great properties. It has antibacterial and antiviral properties. So honey is a really good choice. And if you're going to switch sugar out, then switch out to D-ribose sugar is what it's called, or honey, right? So when we were talking about diet and one ingredient foods, things like that, if you do honey, then it's more of a natural sugar, but you got to make sure that you get a quality honey.
Yeah, I get it from some lady at the farmer's market who has a big bee farm over on her property. Seems to work well. I find also if it's local, it kind of helps with my hay fever too.
Yeah.
So it's cool.
The same environment.
Yeah, same stuff.
Yeah.
So, Nurse Melinda, what's your theory on supplements?
So again, we talked about high vitamin C. It's just something I'm studying, something I'm learning. There are so many people out there who have such great ideas. And as a provider, it's like we know what the medical, the surgical, the chemo, the radiation has always been the way. But then what about the supplements? What about high vitamin C? What about, providing your body with ivermectin or whatever other theories other scientists have done that haven't quite made it mainstream yet? And I love to learn more about that. I really do. I think that there are other options out there, but it is scary. It can't imagine what it would be like to be diagnosed with cancer and then have to face a decision of what now?
What now? Yeah. Oh, yeah. So what if one of the what now decisions is, you got to have surgery. I don't really want to have surgery. So what now?
Well, and that's kind of the thing, when my mom was diagnosed with cancer, from a daughter's point of view. It was, I will support you in whatever. And I'm happy to do that with my patients too, right? Whatever decision you make, we want to make educated decisions. And then you are responsible for your decision. And I think that that's where the gray line with being a provider is if my medical training tells me that you should do chemo and radiation, and you come to me and you say, but I want to do this vitamin, this vitamin, this vitamin, and this regimen according to this scientist's studies, there's this conflict of how can I support you as my friend, as somebody, as a trusted advisor in a process that I don't know has the results that we always look for, or has, nothing's guaranteed, but has more of a guarantee because we've had these cases over and over and over again. And this is what radiation does. This is what chemo does. This is what surgery does for you. And so we can kind of foresee the future of you and your disease process there, where if you just come and say, well, I just want to try this. Wow. You know what I'm saying? Yeah. I want to be that provider that says, okay, let's try it. But you have to be fully aware that if it doesn't work, these are the consequences. This is what's going to happen. Because I think a lot of times people feel lost and they feel like they don't have a choice.
Yeah.
And it's unfortunate that our medical world has been so bombarded with legalities because we expect outcomes, and we live in a world that's ever changing, and the outcomes that we expect sometimes don't happen.
Yeah.
And so despite our best efforts, whether we do the chemo and we do the radiation or we do the surgery or you do the supplements and I hold your hand while you do the supplements, we don't know the outcome. And, when people pass away because of uncertainty, there's a lot of anger and there's a lot of blame, and it's unfortunate because it puts us in a position where we want you to do what's right for you.
Tough situation all the way around, whether to do all of these things or have surgery, and there's no guarantees either way or other. It's just...
There's not. Because you have those theories too that chemo is what kills cancer patients. I don't know if you've heard that, and there are studies where it shows that. So it's like, but is chemo the best option? What kind of cancer are we dealing with? Do you trust your provider? Do you trust the research? And then to have to make that decision is, wow.
Yeah, that's something, and hopefully you can help them make that decision, whatever's right for them.
Yeah.
So, Nurse Melinda, any parting words of wisdom before we head on down the road?
Oh my, I would just say if you want a fighting chance, then you have to be familiar with what a good diet looks like, what a good environment looks like, and what your body feels like. You have got to know who you are and why you are. Does that make sense?
Yeah.
Like, know when something feels out of ordinary and things like that, but give your body a fighting chance and give it what it really needs and wants. And that is a healthy diet, not your brain telling you, oh, this tastes good, but your body telling you, this is what I need to survive.
Yeah.
And make sure that you're making the right choices.
Yes. Well, for those of you who would like to ask Nurse Melinda some questions, you can find her over at Finish First Medical on Bluff in St. George, Utah. What's your phone number again?
The clinic number is 435-500-6734.
And the website?
www.finishfirstmedical.com.
Cool. And you offer free consultations, right?
Yep, the first consultation's always free.
Cool. Hey, we'll see you guys again next time with another exciting episode of the What Now podcast with Nurse Melinda.
Thank you, Michael.
You're welcome.
This has been the What Now podcast with Nurse Melinda. Please like, subscribe, and share. We invite you to join us next time as Nurse Melinda assists you through life's traumatic shit show on the What Now podcast.